Hi everyone, my name is Nicole Harris, and today we're going to talk about HB 2442, also known as Jacob's Law. Okay. So in the United States, there's about 400,000 children currently in the foster care system. 19,000 of those children are in Arizona. 100 children are removed from their homes each month, which means Arizona is one of the leading states in the nation for the number of children per capita in emergency placements. 1,300 children on average, aging 0 to 18, are in emergency shelter beds awaiting a more permanent placement with a foster, relative, or group home placement for over 3 weeks. About 5% of those children annually are in some level of an institution, such as a hospital, detention center, residential, or therapeutic group home. And in the last 3 years, 11,842 children have been successfully adopted through Arizona juvenile courts. House Bill 2442, or Jacob's Law, was signed by Arizona Governor Doug Ducey in 2016. This bill presented by 3 foster and adoptive moms who experienced a significant amount of barriers navigating the child welfare and children's behavioral health system for all of their children. So some of the highlights of this bill include that DCS must refer all children in out-of-home care to the REBA for a behavioral health assessment within 24 hours of removal. Then the assessment must take place within 72 hours or 2 hours if there is an urgent matter. After the assessment, then the first appointment must occur within 23 days, and all services across the board, as long as they're clinically appropriate, have to begin within 21 days. If a service is beyond 21 days, such as if the wait list is long, then the foster or adoptive parents can receive a single case agreement and find their own care through an out-of-network provider. And another piece is if a foster or adoptive parent wants a referral for a higher level of care, such as a therapeutic group home, an HCTC, or a residential treatment facility, that provider has to submit the referral within 24 hours. And then the REBA has 72 hours to respond back with an approval, a denial, or a request for more information. And then there's also the development of the 24-hour foster care line, and then a specific mobile crisis team, a DCS crisis stabilization team. And then the biggest piece of this is that foster parents, group homes, and kinship placements now have the ability to have more of a say and the ability to authorize behavioral health services in lieu of DCS. So with this information, we are going to analyze the following question. Does Jacob's Law increase successful outcomes in youth of DCS custody through providing increased access to behavioral health services? Our pro argument is Jacob's Law is effective in addressing the behavioral health needs of youth in state care. These are the following talking points. First is that Jacob's Law provides a universal and streamlined procedure to navigate children's behavioral health for all of Arizona. According to Access, separation of children from their biological families, cultures, and communities is considered an urgent behavioral health situation. The separation in and of itself is traumatic. Long-term former foster youth have about 5 times the prevalence of PTSD than the regular population, and 2 times more likely to be diagnosed with PTSD as U.S. war veterans. Additionally, although Jacob's Law provides foster parents with the ability to make decisions regarding the youth's care and treatment, it's still expected that all services remain clinically appropriate and follow the Arizona 12 principles. Therefore, the CFT process remains intact, and the biological family should still be included in the service delivery as long as it's appropriate. Okay, finally, having these supports in place prevents the likelihood of future disruptions, and far more adults are likely to become foster parents and retain their licenses. And most of all, for our youth who are placed in adoption, there's an increased support for adoptive families, which therefore increases adoption rates, and therefore it has less children aging out in the system without any kind of permanency. So let's flip the switch and look at our con argument, which is Jacob's law does not improve behavioral health needs and outcomes on youth in state care. And we're going to review these three following talking points. Our first argument is that the physical placement, such as foster, group home, shelter, kinship, should not be able to be the sole decision maker on behavioral health interventions, as they do not have rights to the child. Placements are ultimately unfamiliar with the child's history and background. In many of these behavioral health appointments, especially with providers, prescribers, psychiatrists, it is really important to know the child's history. Are these behaviors new to foster care? Is there a genetic link? How was early childhood development? How was the pregnancy? Are there any issues in school? Are these behaviors or concerns a result of the trauma, or did they occur prior? Knowing these answers are really critical. Other examples are, what language did the child speak at the home? What was the role in the family's culture? Again, these are all very important to provide the right behavioral intervention. This may also cause the involvement in the voice of the biological parent or the family to be compromised. Although they should be invited to the table, there's a heightened risk of them being placed on the back burner or having a more passive role into the child's care. Our second point is retelling the child's narrative, especially when it's traumatic, to multiple service providers who are coming and going with no consistency can also be traumatic. Youth in state care are at a heightened risk of being overdiagnosed and overmedicated. When one considers the adjustment disorder and the psychological impact of removal, what is an appropriate or reasonable response? ADHD and the trauma response can present themselves in very, very similar ways, such as difficulty concentrating or learning, staying organized, being hyperactive, poor sleep, difficulty following rules. All of those symptoms overlap. However, it appears that youth in foster care are 3 times more likely to have an ADHD diagnosis than the general population. In fact, 1 in 4 children are taking at least one psychotropic medication in foster care, seeing massive, massive differences in the prescribing rate. According to the Tufts multi-state study on psychotropic medication oversight in foster care, it was discovered that depending on the state, 13 to 52% of youth in foster care are using some kind of psychotropic medication in comparison to the national average, which is 4% per state. Additionally, not only are youth in foster care more likely to be prescribed psych meds, but they're also prescribed at higher and higher doses. This comes to our third talking point, which is that Jacob's law does not target the root of the problem. The focus should be increasing funding for providers instead. Jacob's law's emphasis is on the quantity of services, not the quality. So Jacob's law provides these parameters for waitlists and timelines. However, let's think about why these waitlists and why these laps of services are there to begin with. These are, include issues like high caseloads and high burnout rate and turnout rate and lack of funding and poor wages. Although there are higher requirements, there's no support for service providers. This means that although there's no increase of manpower, agencies will do whatever they can to abide by Jacob's law. This means pushing referrals through, squeezing as many clients into a caseload as possible, even if a provider is at capacity. So this creates barriers in the service provider providing a genuine relationship with the child, the bio family, the adoptive family, the foster family. And clients are more likely to receive those cookie cutter supports that lack any kind of personalization or creativity. And of course, because there's such a need for supports, medication is often turned to as a quick fix to calm those behaviors. Or more intense supports are utilized, like emergency services, the fire department, police, and hospitalizations. As highlighted before, the higher likelihood that a provider will experience burnout and leave the agency and causing frequent turnovers because of this. In conclusion, both sides have valid arguments. Regardless, though, it's unanimous that behavioral health needs of youth in state care are a huge concern, and social workers and policymakers need to continue to advocate for some of our most vulnerable youth to give them the access to reduce those risk factors and increase those protective factors. Thank you so much.